Well, thank you all for those of you who've come. I know that we have other people planning to come. They'll probably roll in late, but that's okay. Those are on time get rewarded by here in the beginning. I'm excited you're here. And you know, I'm going to be going a lot off of the screen on this side. So can everyone see it? Do we need to turn it a little bit more perhaps? This has been an interesting topic for me because I've known about sleep breathing problems. I've known that it could be a problem, but we have a couple of doctors that work in our practice. We have Dr. Montez that's here with us from Mexico, and we have Dr. Preble, who I don't even know where he is. He's in California, he's somewhere, and they're both out of town this weekend. So the problem was I was the only one left to teach the class, and I'm not the one that's the sleep expert in our office. So I thought, how's this going to all go down? Well, it's actually been the very best thing that could possibly have happened, I think, because I have been intensively studying this topic since I learned I was going to have to teach it, and I am a believer times 10 now. Because, in fact, those of you, the people who work with me every day, can you tell a difference this week? All of a sudden, I see the reason that we're here having this conversation and teaching this class today. And that's the meaning of the title, Could Sleep Be Killing You? Because literally, it could be killing you. We're going to talk about that. And not like tomorrow, but it might shorten your lifespan. It might lead to chronic disease that's going to kill you. But I'm probably going to be referencing this a little bit more than I usually do. Usually I'm pretty free flowing. I don't really look at this, but some of this material is new to me too. Okay, it is an epidemic. We're going to talk about some statistics in just a minute. But you know, first of all, let's talk about what is sleep disordered breathing. What does that even mean? Really, it's a spectrum of things, everything from snoring, having a stuffy nose, just having a problem breathing when you're sleeping. So there's a whole bunch of different things that could fall under that same category. And it's interesting because there's a lot of things in our world, pacifiers, bottles, sippy cups, those sorts of things that have changed the way that the place that the air goes through, it's changed the way that it's formed. And because it's changed the way it's formed, oftentimes we have narrower airways than people might have had 200 years ago. So what does that do? Well, if there's a narrower tube for air to go through, it's harder for the air to go through, right? Oftentimes we can push through the immediate symptoms if we're sleepy, if we feel like, oh, I don't really feel rested in the morning. You know, I'm sure all of us have had a morning like that. And you wake up and you just think, oh my gosh, did I even sleep last night? But you get going on your day and you do your day and you push through it, right? It's the long-term chronic effects that creep up on you though. You push through a lot of the smaller things, but they creep up after a while. So a lot of us are operating at what really is a suboptimal level all the time. And because it's all the time, we just get used to it. We just think that that's the norm, that that's how we should always be feeling. And if anybody, you need the handout, there's a handout over here on the table. And there's actually a quiz attached that you'll be interested in looking at because we're going to talk about that in the morning, or in a minute. So not in the morning. We're not staying that long. Sorry, I know you wanted to. Sleep studies right here on the house. So how common is this problem? You might think, oh, I bet only a few people are affected. Actually, studies show that 2/3 of Americans actually have some sort of sleep disorder. Whether it's mild, whether it's moderate, whether it's severe, that all fits in this category, but 42 million people have a sleep disorder, and 90% of those people, it's undiagnosed. It's undiagnosed. So that means 1 in 5 adults has mild sleep apnea. So if you figure this room has, I don't know, 20 people, so 4 people in this room might have sleep apnea. 1 in mild to sleep apnea, 1 in 15 have moderate to severe. That means probably at least 1 or 2 of you might have moderate to severe sleep apnea. It's Laura. She's going to just raise her hand right now and call it out. So this is very common. If you're sitting here thinking, oh, this is probably not me, maybe it's my daughter, maybe it's my husband, maybe it's whatever, it's probably you too. And why does it really matter? Well, there's a huge correlation between sleep disordered breathing and chronic disease. We're going to talk in a little bit about why that's the case, but 80 to 90% of people with diabetes have oral sleep apnea or have obstructive sleep apnea. 50 to 95% of people that have had a stroke have this. 20 to 35% of people with heart failure have this. If you have a sleep obstruction problem, you have a 4 times greater chance of having an arrhythmia at night. This was really interesting. Someone who has a sleep obstruction problem is 15 times more likely to have a severe traffic accident. So these are significant things that you really want to prevent. So a sleepability quiz, I handed that out to you. So there's a couple of things on that handout. There's a sleepability quiz that you can take for yourself or give it to a family member or whomever and test yourself and say, how do I test on this? And then the other one is some of the, I can't remember, what is the other half of it? Is it signs or symptoms that you may have some sleep problems. So there's a lot of things on that sleepability quiz that you may not think about. Even things like, do you grind or clench your teeth? A lot of times people every single day say, oh yeah, I just grind my teeth. Well, 100% of grinding teeth is usually because of a sleep issue. So this isn't something that we just ignore. So take that quiz. It's an interesting thing to figure it out. All right, why does it matter? I'm really not very techie. I was just joking with my husband that if he tells me something to do on the computer, I probably didn't listen because I really don't understand what he's saying. But I know that if you're backing up a computer, if you stop it mid-backup, the reason I know this is because he backs up the computer from the office end here or at home on our home computer. And sometimes I just get impatient with it and I don't want to let it keep going because I want to do something on the computer, so I stop it. And then I get in really big trouble because then it has to start over again. If you stop a backup, you have to start the backup completely over again. It doesn't just pick up where it left off. Our brain is a lot like that. When we're in the deep sleep mode, it's like it's time for our computer to back up here. If we arouse or wake up during that backup process, and it may not even be like that we know we're waking up. Does that make sense? Like sometimes when you wake, your body wakes up, but you don't know that you've woken up. If you wake up during the time this computer is trying to back up, it has to start back over again. And it never really finishes that regeneration, that rejuvenation, and you won't be healthy. So if you're not healthy unless your sleep is healthy. It's just the way it is. Sleep causes, well, the reason it says this is the most important health stat you don't know is because we spend 1/3 of our entire life sleeping. Think about that. What else do you spend 1/3 of your life doing? Nothing. Nothing do you spend 1/3 of your life doing. You don't spend 1/3 of your life working. You don't spend 1/3 of your life playing. You don't spend 1/3 of your life, doing anything, eating, nothing. 1/3 of your life is spent sleeping. This is the most important thing that we do to live. So if your body has to decide between sleeping and breathing, what's going to win? Breathing. Every time, because we die if we don't breathe. Nothing else takes as much time. Nothing else is as important of a job as sleeping for you. So this is the most important thing that we can ever really spend our time figuring out and learning how to do better. It's an inflammatory disease. So these sleep issues lead to chronic inflammatory diseases. All of us are going to die from an inflammatory disease. That's just what we end up, that's what aging is inflammation, which then leads to eventual death. What we want to do is to lengthen the time between now and that, right? And so we need to get rid of all sources of, or as much as we can, of inflammation. And this is a huge one. It affects every system in the body. It's related to high blood pressure, stroke, cancer, Alzheimer's, diabetes, depression, you name it. It's on the list. If it's inflammatory, sleep will affect it. So it speeds up the aging process, and I think it might be in here, but if it's, oh, actually it says it on the next screen. This is one of my favorite things that it says right here. 20% shorter life expectancy. That's huge. So I started doing the math. That means if you would have lived to 100, with a sleep disordered breathing problem, you'll live to 80. If you would have lived to 80, you'll live to 65. If you would have lived to 70, you'll live to 55. That's huge. That's huge. That's a huge reduction in lifespan because of this, because of the inflammation it causes. And I've heard it said that this is actually rivaling smoking and obesity as some of the greatest public health challenges that we have today. And it's not just being sleepy. You know, it's not just being sleepy that it's a problem. It's all of these things that it causes. Like I said, even though you're able to push through those short ones, the short-term things, the sleepiness, you really can't overcome those long-term things. It wears out your body. So let's talk about why. All right, when you are awake right now, every single person in this room, the muscles in our head and neck keep our airway open so we can breathe while we're sitting here. When you go to sleep, particularly when you get into the deep sleep mode, what happens is all of your muscles are actually paralyzed. They get paralyzed and they just go really limp. That's what we want, because we just want to have the download time, right? All of our muscles just are paralyzed and we go really limp. Well, that includes the neck and throat muscles as well as the tongue. If the tongue falls back, if there's already not enough room back there for everything as it is, when it goes limp like that, it'll block off the airway. The body says, again, if it has to choose between breathing and sleeping, it's going to choose breathing. So it's going to panic, and you're going to breathe deep, and you're going to get startled. You're going to grind your teeth. You're going to roll over. You're going to turn. You're going to open your mouth. You're going to do whatever you can to breathe, and then you're back to sleep again. During that time, what's happened is it's turned off the download. It's stopped regenerating. Everything has to start over again. It spiked your adrenaline because you went, it spiked your adrenaline, and you're in panic mode all night long. It wears your body out. Your body ends up running out of hormones that help you deal with stress in life. So when I'm getting stressed out, during my day, if I'm getting stressed out, adrenaline kicks in, right? You feel this, right? I had a patient today that was really struggling, and I was running on adrenaline because I needed to keep up with her and help her. When I left the room, I kind of went, because you have to come down from that adrenaline spike. Well, if you're using up all your adrenaline all night long because of these mini panics of I'm stopping breathing, I have to stop breathing again. If you're using up all your adrenaline, then when somebody cuts you off on the street while you're driving, you got none left to deal anymore. If your kid does something that didn't really make you happy, you have nothing left to deal anymore. This is called adrenal fatigue. You run out of the hormones necessary to deal with stress in your life. This leads to that. Then what happens is your body starts to compensate by figuring out how to use other hormones to take care of the stress, like thyroid hormones. Anyone low thyroid or know anyone that's low thyroid? Because our bodies are stressed out, we're in adrenal fatigue all the time, and we're starting to now borrow other hormones from elsewhere to try and keep up. So it leads to adrenal fatigue, chronic fatigue, thyroid trouble.
Weight gain.
And weight gain's a huge one because the body holds on to whatever it can just as a protective measure. Yep, hugely. All right. We're going to introduce Dr. Montes now. We're going to turn up his volume. Okay, can you hear us?
Yes, I can hear you
Ooh,
great.
and
Thank
you're
you.
loud.
Great presentation. Are you able to hear me all right?
Yes, very good. Thank you.
So it's interesting. Just today, I spent some time this morning. As Michelle mentioned, I'm visiting with you tonight from Mexico. I'm in the Yucatan Peninsula, and I was snorkeling with my teenage son and daughter. Now I have an 18-year-old teenage son, and I try to keep up with him, and I'm not as good at doing so anymore. We were snorkeling, and he swam deep down under the water to go into a little cave and come out the other side. And so I went to follow him. I took a deep breath, and as I was swimming down under the water, I could start to feel as I was reaching my end point there, and I was getting to where I could come up for air, but in those last few seconds, and you could all practice this yourselves, holding breath. There's that panic mode that your body goes into. And so what we're talking about here is throughout the night, our body is slipping into that stimulated panic mode, and that's it's a terrible way to live, and that's what we're doing to our bodies when we don't have a good airway. But I experienced that myself just this morning. I wanted to just touch on some myths that are associated with.
So he is following this. Actually,
did
I go back?
If you're snoring, it's that you're just fine. There is no healthy snoring. Snoring shouldn't be happening at all at night, especially if you're a frequent snorer. That's a sign of a problem. And if you're snoring now, it's probably because there's some airway disruption already that developed earlier in life. The second one is, if I don't have sleep apnea, and everybody talks about, we've all heard about sleep apnea and the medical connections with that, where we stop breathing at night. Some of us have gone so far as to having done a sleep test and been told we don't have any sleep apnea. And if that's the case, well, it's great. All that means is the progress of the disease is a little earlier in its progression. Doesn't mean that we're fine, and it could very likely still be some sleep disordered breathing, and the system's just working well enough to compensate that we haven't stopped breathing altogether. The idea that weight loss is necessary to improve our sleep quality, that's just not true. While the extra mass on our body, or someone that's overweight, puts additional pressure on the organs and the lungs to continue to breathe, there's more to it than just losing weight. And in fact, oftentimes, and this is my own experience, we can't lose weight until we correct that sleep disordered breathing. My experience, and I say this is my own story, I 2 years ago did some testing myself and determined that I had some sleep disordered breathing, even some mild apneic events, meaning I stopped breathing a couple times throughout the night. And it turns out that once I corrected that with some of the little therapies that we'll discuss here, I think later in the presentation, I immediately lost about 8 to 10 pounds of weight, because of the stress hormones that are released throughout the night when we get in that panic mode that Michelle described. That cortisol level is chronically elevated, and that prevents the breakdown of fat, among other things that are happening physiologically in our body. And so it could be frustrating to try to lose weight if there's some sleep disordered breathing happening. The idea that children are our best sleepers, that's, I heard it said sometimes, gosh, I sleep like a baby. I wake up every 2 hours crying. My bishop said that when he was first called to be a bishop. But children are often experiencing some degree of sleep disordered breathing, and because they're so young and their bodies work so well and are healthy, that those symptoms are kind of masked because they're not having sleep apnea. But children often struggle with sleep disordered breathing. We'll get into that a little bit more here in a minute. The fact that people with sleep disordered breathing need to sleep with a machine and an oxygen mask and all this here, that's not always the case. And there's some early interventions that we can introduce into the equation that can eliminate the need for that, or keep us from getting to that stage of disease. I don't know that I've ever heard it said it's adorable when my child or partner snores, except if it's the husband saying it about his wife. But again, there's no healthy snoring. I think so. Any snoring or mouth breathing is problematic. And the last one, where we say sleep problems can be cured by sleeping on our backs. While it is true that most sleep breathing problems are worse when an individual is sleeping on their backs, and we'll talk about the anatomy of why that is, just being a side sleeper doesn't cure it. So I guess we go on to the next slide there, Michelle.
Yep, got it.
Traditionally, we've looked at in sleep medicine and sleep dentistry, we've looked at the overweight older man who snores, that stops breathing overnight. This picture kind of shows the person that's kind of diagnostic of that situation. But we kind of here, because of our vision of total care dental and wellness, we want to expand the tent and look at and identify some of these cases before it gets to this stage. And the first one I'll look at on the next slide, when we talk about a new model for screening sleep disorders. Here's a 10-year-old child, very handsome, happy kid. This is my son, Caleb. and Caleb, he looks like a very healthy, happy, functional boy. But if you were to put your hands up and just kind of block the rest of his face and just look at his eyes, can you see that his eyes look tired? Yeah. You know, he has those little allergic shiners or dark circles under the eyes. We see this so commonly in children. They're children who have ADHD or anxiety, younger children who wet the bed frequently, can't concentrate in school. These are all signs of poor sleep breathing and possible airway problems. Children who can't concentrate at school or who get chronic sinus infections and ear infections. The fact that's a sign that the immune system isn't functioning optimally, and that's due in part at least to the quality of breathing and airway during our sleep. Children should never snore, and children who have allergies. Again, allergies is just an overactive immune system or a dysfunctional immune response, which again can be connected with sleep disordered breathing. So this next slide, here's another common individual that we'll see presenting with sleep problems. The young, fit male or female who, and it's rampant today. It's really a epidemic. Women with chronic fatigue and hormone imbalances and thyroid problems. These are all connected with those physiological stressors that Michelle discussed. Individuals who have trouble losing weight, especially women, anxiety, migraine headaches, chronic pain. Again, during certain sleep cycles, when we're in our deep sleep, that's when our body regenerates. That's when it produces hormones. In our REM sleep, that's when the nervous system heals and memories are stored away. Like Michelle was saying, the computer hard drive is being backed up. And so any disruption of those complete quality sleep cycles throughout the night can lead to some of these things. So, you know, common groups that experience sleep disordered breathing, you know, individuals who are athletic, folks who suffer from seasonal allergies and hay fever, children who are diagnosed with ADHD or ADD, which again is epidemic today, and the model has been just to medicate these children. It's sad and it's terrible. As I mentioned, my own son had some sleep problems that we were able to resolve with an appliance and some orthodontic correction of his teeth, and he's sleeping better. His anxiety has completely resolved. And the last thing on this list, individuals who grind their teeth and clench their teeth, that grinding at night can be a part of that protective mechanism where the body's waking you up, bringing us out of that deep stage of sleep so that we can take the next breath. And oftentimes along with that, there's additional acid erosion with what's happening there. So I love this next slide. This is the same young lady in both these pictures. And we can see the difference in just the shape of the face. You notice on the left side, her lower jaw is kind of back and protruded. She's tightening her lips to be able to close her mouth. If her muscles were all relaxed, she'd be sitting with her lips open and she'd be breathing through her mouth. But just visually, we can see how on the right side it looks more natural. What's happened here is we corrected some anatomical problems where there was some skeletal deficiencies that with orthodontics and sometimes coupled with some oral surgery, we're able to bring the jaws back to the proper shape. And now this individual is able to breathe. Look at her eyes on the left side. Her eyes are closed. They look a little tired, and there's some little dark rings around the bottom of her eyes. On the right side, her eyes just look bigger and brighter. There's definitely a change in her countenance. All of that are just signs of more vitality and health. So in this next slide, we can look at the anatomy of what's
probably about 2
happening
years.
when we sleep. Even if we have a small airway, and when I talk about the airway, we're talking about the little hose or little tube that goes from our mouth and nose down into our lungs. When we're awake, the voluntary muscles are keeping things open and we're able to breathe. The body's always going to take the next breath. That's the priority for our body, is to take that next breath. Anything else is secondary to it. And so when we're awake, your tongue is never going to slop back in the back of your throat and off your airway. Your body won't allow that. You're going to hold your tongue forward so you can breathe. But when we go to sleep, and especially when we enter those deep sleep stages, all those voluntary muscles kind of relax, and everything, the soft tissue, the tongue, and other things kind of go flaccid. And especially when we're laying on the back, like in this picture, everything just falls to the back. And what happens? It pinches off the hose. And then the body has to take that next breath. So what's it going to do? It's going to stimulate us and wake us up and bring us out of that deep sleep into a lighter sleep stage, so the voluntary muscles can open the airway and we can take the next breath. And so throughout the night, this is happening to these individuals, and we're constantly being stimulated, and those stress hormones are being released, and if we're young and healthy enough, or if the system's working well enough, we're gonna take the next breath. And so our breathing doesn't suffer, but what does suffer is the quality of our sleep, because we're breathing at the expense of good quality sleep. So moving on to the next slide, some signs of maybe an individual who has some sleep airway or sleep breathing problems. Anytime we're mouth breathing it's inappropriate. We should always be nasal breathers. Pay attention to what you're doing right now as you're sitting here in this room. Are your lips closed and are you breathing through your mouth? Those of you I can see in the screen right here, I see a lot of that happening. That's how it should be. When we're asleep, when we're awake, and when we're asleep, we should be breathing through our mouth. So if your spouse
Nose
or your child is sleeping with their mouth open and breathing through their mouth, or breathing loudly through their mouth, there's a problem. If the bed sheets are twisted and wrapped around when you wake up in the morning, your bed's a mess, it's probably a sign of that restless sleep, and the tossing and turning is a sign that your body is getting woken up and stimulated and you're not breathing well. Dry mouth. If you're breathing through your mouth, of course, that's going to dry out the inside of your mouth, and you'll wake up with that, what you call cotton mouth, or just a dryness. In extreme situations, your tongue sticks to the roof of your mouth, and you need to get a drink of water throughout the night. Those of us who have morning headaches, or really any chronic headaches or migraines, is a sign that we're not oxygenating our brain properly and not getting the sleep that we need. And like I said, tossing and turning or moving around a lot during our sleep. That should be a restful time, not a stimulated time. On the next slide, we'll look at some causes of disordered breathing in our sleep. A lot of us, when we were younger, had orthodontic treatment to straighten out crooked teeth. Used to be that the dentist and the orthodontist, and sometime even today, that they would pull teeth to make room for the rest of your teeth in your mouth. Well, when those teeth are removed, as they close everything up and close up the spaces, then the jaw stops growing, because there's no need for the jaw to grow anymore. The space has all been filled in, and we end up with a very small mouth, or a small box to hold in the tongue and all the soft tissue. And now when we go to sleep, that tongue has nowhere to go but back into the back of the throat. If we see crowding, and we'll look at some pictures here later on, crowded and crooked teeth, there again, that's a sign that the jaws are smaller and there's less space for the soft tissue. In children and infants, if they used a bottle suck their thumb or a pacifier for a long period of time, or they used a sippy cup, that sucking motion, again, is working against the growth of the jaws. In fact, think about it. If you were to sit here, purse your lips, and suck in, what are those muscles doing? As you suck in with your lips together puckered up, those muscles are pushing in on the face and jaws and squeezing and making it smaller. And over time, that child who's always sucking on a pacifier or goes to bed every night with a bottle in their mouth, that sucking is, those muscles are pushing in and making the jaws smaller. And that is the child who's going to have sleep problems and as an adult, probably have sleep apnea, and that's some of these problems that we're talking about here. Children with, or any individual really, with allergies, when we're not breathing properly through our nose, we're not stimulating the immune system and creating nitric oxide, which then causes us to be more prone to allergies and sinus infections. And then that makes it harder to breathe through our nose. And so then we breathe through our mouth more, and it's kind of a vicious cycle that never corrects itself. Having a large tongue, I actually think it's less of a large tongue and it's more a case of a small mouth that can affect or block the breathing. Like that picture we saw earlier of the little girl, the receded chin, where the facial profile, the chin is drawn back from the rest of the face. That's a sign that there's a small jaw space and probably a likelihood of disordered breathing. And high body mass index, again, all that extra body weight can put extra pressure and kind of push everything into the space where the lungs should be, and that's going to make it harder to breathe. One sign in adults is the circumference of the neck. If you have a little large, round neck, that's a sign that there's some blockage of the airway. Michelle?
Nope, is it me? It says right here, this is where I will start again. Thank you. Now you see why we piped him in from Mexico. Very good. So why in the world are we talking about this? Why is a dentist talking about this? The primary reason is because a lot of the signs and symptoms related to sleep disordered breathing show up in the mouth. So who's looking in your mouth? Hopefully twice a year, if not more. The dentist, right? This is what we look all the time. So we're going to look for things like tongue tie. If you have a tongue tie, your tongue can't come forward, it's going to come back. It also can't go into the roof of your mouth and form the roof of your mouth the way it should to allow room. Large tonsils, you can imagine why that's a problem. A large tongue, or like Dr. Montez said, a small mouth, crooked teeth, missing teeth, previous braces. Just today, so I think I saw 6 new patients today. Of the 6 new patients I saw, the two of you who know this, I would say maybe 5 or 4 of them, I pretty much said, you've got a severe sleep disorder. So at least it was well over 50%. I would bet 60 to 70% of the people I just saw today had issues here.
Michelle?
Uh-huh.
Had any of those individuals been told that they have any breathing problems?
Very good point. No, none of them had been told, but they all said things like, I have insomnia, I don't sleep well, I wake up a lot, I never feel rested when I wake up in the morning. They all had signs and symptoms, but none of them had ever thought, this is something I could do something about. Or, well, actually one, she's been on tramadol, so medication to help her sleep for years. And I said, well, did the doctor ever talk to you about why you weren't sleeping? And she said, no, they just gave me a pill. I said, well, when you have to refill that prescription, what do? They just refill the prescription. I said, well, certainly don't you think it'd be good to maybe find out why you're not sleeping? And she's like, well, that's why I'm here, so good, I'm glad. This is one of the things, so some of the things that we look at every single day. Do you grind your teeth? If you grind your teeth, it's usually your body waking you back up again. Clenching, because so try this, squeeze your teeth together. When you do that, feel what your tongue does. It tightens up, right? So if your tongue tightens up, it's gonna pull itself out of that airway. So if your body needs more room to breathe, it's gonna squeeze your teeth, tighten that tongue up, pull it forward. So if somebody grinds or clenches their teeth, almost 100%, it's an airway issue. Do you have erosion on the back of your teeth? What that means is the backs of the teeth, are they getting thin? Are they getting worn out? Do you have a scalloped tongue? You may not know what this means. On the sides of the tongue, if you look at your tongue, just last night I was looking in the mirror, I'm like, do I have a scalloped tongue? I'm trying to check this out myself. How would I tell? So I learned, don't stick it out too far, because if you stick it out too far, it just kind of flattens out. So let it kind of be back in your mouth and look and see, do you have little kind of scallops on the side of the tongue? And you'll be amazed. You might have that. What that is when you do that grinding squeeze, that squeeze, it sucks the tongue in, creates pressure, and it sucks the tongue into the inside of these teeth right here, so it makes indents that match the teeth. Yes?
I have a question on that. So does that mean that the bottom jaw is too small or the top? I mean,
Think about the way they work. The bottom jaw fits inside the top jaw. So the bottom jaw dimension is determined by the top jaw. There's no way it can get wider as long as the top jaw is small. So it follows function, basically. So the top jaw has to expand to allow the bottom jaw to have more room for the tongue as well. So they fit inside of one another, kind of like those, stacking cups or whatever. One fits inside of another. So you have to expand the top one to be able to get that bottom one enough room. It's the place everything starts.
I
Yes.
have a question. So my husband's used to CPAP for 7.5 years. Right? And I've started saying to him, but why don't we try to fix something? This is my comment. He's like, what? And I'm like, I'm used to this. I'm like, I know, but why don't we fix what's wrong or causing the apnea instead of just treating, the symptom, right? This is a symptom, just anyway.
Yeah,
But-
yeah.
Or a pill, right? For sleeping.
Or a pill.
right?
Yeah,
Or a
there's
pill.
things we can do to
It's
cover
the
up
same
the
thing,
problem.
right? And I think CPAPs are important, right? And I'm really grateful he has it because he's not dying in the middle of his sleep,
Absolutely.
right? And all this. But
Absolutely.
if it can be fixed.
Yep.
Anyway,
Yep. I love that.
I'll get him in here soon.
Sooner or later. Mallampati score is another thing we look at. Mallampati is a guy's name, but then we just call it that. And so we say, okay, say ah, gently push down the tongue. We should see the back of a throat like that. We should be able to see back past the uvula. Everybody calls it the hangy downy thing, You should be able to see past that a lot of throat. This is a Mallampati 1, 2, 3, 4. I can't tell you how many times I see this. And we say, well, how in the world do you expect to breathe? There's no hole, there's no tube, there's no place for it to go. So these are all things that we look for when doing a dental screening. Do you have a large tongue? Again, it's probably a smaller box, that's the issue. Do you breathe through your nose? A woman today, one of these new patients I was talking about, I walked in the room and about 2 minutes in the conversation, she said something about sleep, and I said, the moment I walked in the room, I knew you had sleep problems. And she's like, why? Because she has a long face, she breathes through her mouth, she couldn't even keep her lips together even while she was sitting and talking to me. I said, these are all signs. And she's like, oh my gosh, I'm so ready for this. Nobody's talked to me about this before. So any of you watching the video too, if you're not coming here, these are the things to ask your dentist to look for. Do I have these things? Why do you need to sleep well? This is so self-explanatory, but we might as well say it, right? All of these reasons, it's been proven that it protects, things like protects against cancer, okay? Does anyone care about that? Reduced risk of diabetes, reduced risk of all sorts of things, depression, chronic pain, helps you regulate your hormones, you have more energy, you have a better memory, you can lose weight. Laura, what happened once you got some help with your sleep?
Well, I have started to lose weight really fast, and I'm in my 60s, and it's hard to lose weight when you're that wonderful age. And it just motivated me to start eating better, and then I was losing weight, so I started exercising more, and so hello, 27 pounds down, baby.
Yeah, it makes a difference. It makes
It
a
really
difference.
does.
When you
I
sleep and
pop
you have
up
the
like
energy and
So
yeah.
much better.
Yep, it makes a huge difference. So that's why she raised her hand when she said she's one in the room that has severe sleep apnea.
I did, and so I have to have, and Dr. Preble actually made a DNA appliance for me, which means day to night appliance, which helped me not snore, but I still wasn't breathing as deep like I should, so I have to wear both, but you know what? I wake up in the morning now feeling human. It's so much better.
Yeah, it really makes a difference. It makes a huge difference in the way you feel. Those are the outward symptoms, but in also the way your body operates. So some of the symptoms, and that I believe is the second sheet that I have for you. Some of the symptoms that really can affect, you can start to find or see if you have a sleep problem. Like I said, you can push through the sleepiness, right? You know, we're all strong-willed people. We can push through this. This is the kind of stuff you can't push through. You can't push through even things like craving high-calorie foods. Isn't that interesting? Think about it, when you're sleepy, like when do you want to eat like that ice cream? It's like at 10 o'clock at night, right?
Yeah.
Because you need that burst of energy. So if you're waking up that way, of course you're going to crave those things all day long because you need that burst of energy. Okay, why don't we know it? Why is 90% of this undiagnosed? Because we're a terrible judge of our own sleep. We don't know what we're missing, right? Have you ever
sleep alone?
How would we know?
Sometimes I wake up and my dog's under the bed, but that's the best I can do.
Until her granddaughter told her that, what did she say?
Oh, my little 3-year-old granddaughter spent the night at my house for the first time. She was in my bed, and all of a sudden in the night she was crying, and I said, "What's the matter?" And she said, "I hear a scary sound." I said, "Well, what is it?" And she said, "It's coming from your mouth."
So you never know. So that was Laura's first sign. So yes, you may be sleeping alone and nobody's alerted you to this fact. You don't know what you're missing. I mean, have any of you ever slept anybody else's sleep? You know, I mean, you don't know how everybody else feels when they wake up in the morning. The changes are subtle. You know, it's not like when you have a baby and then all of a sudden you've never slept again for the next 2 years. You know, it's not like that. When these things just happen subtly. Oftentimes, good health will really disguise this as well. You know, you're okay. You feel okay, but it's being disguised. And we assume sleep is automatic, that it should just happen, right? It should just happen. So we do have some sleep screening tools, or actually there's some home sleep screening tools that you can do. These are some new ones. An Aura ring, it's a cool little ring that will also track a bunch of things. Apple Watches, tons of people have Apple Watches, Fitbits, all of these things. The ones that I actually really like are these, Sleep Talk Recorder, and there's some apps on your phone. The Sleep Talk Recorder is interesting because if you push play and just have it recording while you're sleeping, then you wake up in the morning. I actually thought about this. I thought, I don't want to listen to 8 hours of myself sleeping. That sounds like I've got better things to do with my life. But, you know, if you kind of fast forward and listen, does it sound restless? Do you hear yourself talking or snoring or making noise or whatever? So those are some really simple things you can do to just say, could this be an issue for me? Is this something I should find out? And
Michelle, let me tell you one more thing.
yes.
I found that I was always getting up to go to the bathroom and didn't have to go to the bathroom. And I'm like, why am I always like sitting in this bathroom in the middle of the night with nothing going on? But I've recently learned that because when you can't sleep, your body thinks, well, maybe I have to go to the bathroom.
Well, what happens is when you're in the deep sleep mode, it actually creates, I think it's I can't remember if it's a hormone or an enzyme. I think it's an enzyme that turns off the need to go to the bathroom. So if you're never there, then you're awake and your body goes, I better go to the bathroom. I'm not sleeping anymore. All right, you got to get up and go.
So that's another thing to watch for.
Sleeping, yeah, absolutely. Going to the bathroom in the night is a sign that you're not sleeping. Yep. Okay, Dr. Montez, you're up again.
So you mentioned some of the home screening tools that we have that are easy to use to evaluate a little bit the quality of our sleep. Some things that we use in our practice to screen for some of these sleep problems are, the first one is the Epworth Sleepiness Scale. And what it does, it's actually like a questionnaire that basically you can go through and answer a series of questions, and it kind of helps identify some of these risk factors and determine whether there's a risk of some severe sleep disorders because of the signs and symptoms that we're noticing and experiencing. One test that I really love that we use in our office is what's called heart rate variability. What that is, it's a measure of our autonomic nervous system function. When we talk about our autonomic nervous system, there's this balance that's always happening between the sympathetic and parasympathetic nervous system. That is, the sympathetic is the fight or flight response, that panic mode that Dr. Jorgensen mentioned a little bit ago, where we have to, if we want to talk evolutionarily, that's what kicks in the adrenaline and allows us to be able to outrun the saber-toothed tiger. But we can't live in that mode. We're made to then be able to switch that off so that our body can rest and regenerate and heal. So heart rate variability is a single line little EKG. It's an little sleep device that you would pick up from the office. You put it on at night and you sleep a good night's sleep. And it gives us then a report that we're able to read and has some really strong correlations or measurements as to what our autonomic function is that strongly correlates to the stages of sleep. And so we can tell at a glance whether we're cycling into a good restful deep sleep or if we're staying up here in that lighter sleep where we're chronically stimulated.
And I didn't tell you, but I added in the pulse oximeter test on that one too.
Yeah, and another test, that the little pulse oximeter, and there's different ones that we have in our office. It's a little something that connects to our wrist, and it looks like a wristwatch, and it has a lead that holds onto the tip of your finger, and it measures your blood oxygen throughout the night. And so if we're having some disordered breathing and we stop breathing throughout the night, we're going to see that in number one, the measurement of our pulse rate increasing, and number two, it's going to measure the blood oxygen level, and we're going to see that dropping throughout the night. In a severe case, someone who has sleep apnea, their blood oxygen would drop into the 70s and lower for extended periods of time. You can't stop and hold your breath long enough to affect that blood oxygen. You can, if you tried, wait, you can't do that. So that tells us how severe these little sleep problems are. And so going on to the next study, how we diagnose it, as I mentioned, once we determine by some of these screening tools that there may be signs of sleep disordered breathing, then we determine where we go from there. In some cases, there's some therapeutics that we can do within the office, and we'll get into that, I think, a little later in the presentation as to what the intervention is. But in some cases, we need a definitive medical diagnosis, and so we'll make a recommendation to a sleep physician to either read the report from one of our home sleep studies, or you go to a sleep center where you'll sleep in a hospital type of setting, and they put different leads on you and they measure the quality of your sleep and your brain waves and your blood oxygen and all those things. That's what's called a polysomnography. And that's kind of the gold standard for measuring the sleep quality. The little caveat to that is it usually requires a referral, and it's done in a sleep center. Now the next slide, this is what I was talking about in terms of treatment, or what some of our interventions might be in these cases. And there's a whole range of them depending on how we present, what the symptoms are, and what the severity of the disease is. Sleep hygiene, and Michelle's going to talk a little more about what that is. Sleep hygiene is just things we can do, things we can control in our environment that'll improve the quality of our sleep and improve the situation in which we're sleeping, so that we can get a better quality or better night's sleep. Side sleeping, I mentioned before that the worst situation, especially for at-risk individuals, is laying on our back because of anatomically what that does. It allows the tissue to fall in the back of the mouth. If there's excess body fat, it's going to push on the diaphragm and make it harder for those muscles to breathe. Sometimes a CPAP, that's what we see here in this picture, the oxygen mask, where it's positive pressure oxygen breathing throughout the night. That little positive pressure, that puff of oxygen, opens the airway and drives the air into where it needs to be, so that it overcomes the tissue that might be in the way. And below that, there's a customized mouthpiece that creates more room for the airway and the soft tissue. I mentioned earlier that this is kind of a personal journey, because I myself had some sleep and breathing problems and some mild sleep apnea. I tested myself and fabricated a mouthpiece. In fact, a mouthpiece that fits on my upper and lower teeth that opened up my jaws to make enough room for the tongue and the other tissue, and it completely eliminated the apneas and the sleep disorders that I was experiencing myself. And I thought I was a great sleeper. I could fall asleep at the drop of a hat. I thought I slept through the night. I knew I was kind of a light sleeper, but I thought that was just me. But since I've corrected this, I sleep much deeper. I don't wake up throughout the night. I feel more rested, and as I mentioned, I was able to lose some weight and have some other health benefits that I didn't expect and I wasn't looking for. Some of these mouthpieces are, like it says here, a mandibular advancement device that moves the jaws forward. It brings that lower jaw out and does the same thing in creating a little more space and pulling the tongue out of the way. I think Michelle has a slide that'll show diagrammatically what that does. And so these are all control measures. A way to resolve the actual problem is to change the anatomy and shape of the jaws. That last thing on the list, the DNA appliance, it directs or guides the growth and expansion of the actual jawbone. And so even in adults, we can increase the size of the mouth and make more room for that airway. In children, this is amazing. With an appliance and sometimes orthodontic treatment, we can get ahead of these problems and correct any sleep disorders by expanding the jaws and preventing disease that's later in life. So that's what I call kind of a resolution strategy, because then we're not married to a mouthpiece or a face mask or something. And that's ultimately, I think, what our goal always should be when we can. And I think, Michelle, you want to talk a little bit about some of what sleep hygiene means and what we can do to improve our sleep, yeah?
Yes, so, you know, the way our body works is we run on a 24-hour clock. And there are certain times, so the way I've heard it explained is think about going camping in the mountains. So you're going camping in the mountains, you play all day, you have fun. Then what do you do in the evening? You light a fire, the sun goes down, you sit in front of the fire, it's quieter, it's dark. What color is the fire? Orangey, yellowy, red, warm colors, right? It gets cooler at night, right? Everything gets a little cooler. And after a while, you just go to bed, right? Because what else is there to do? Then what happens when you get in the morning? The sun comes up, the birds start chirping, it starts to warm up a little bit, and you wake up. That's what our bodies are built to do. To wind down, the red, orange, yellowy lights in the evening, getting a little cooler, all those sorts of things. And then when we wake up, it should get a little warmer. The light should be bright, full spectrum. That helps to wake us up. So if you think about our life, we don't really do that, do we? I mean, right now we should all be sitting in front of a fire. And instead you're here, listening to us. So we don't really do that all the time. But we really should try to as much as possible. So in the evening, calm it down. There's all sorts of things. I think it's coming up here in a minute where you should put blue blockers on your, I have a program on my laptop, I have a program on my phone that at a certain time in the night, I think I've set it for 8 p.m., all the light goes to a blue kind of, like an orangey, reddy sort of light on all my devices. Everything gets calmer, we cool the house down, all those things happen. If you will start to do this, your sleep will improve just because you do that. Sleep in cycles, not an hour. So there's a sleep cycle that we go in that goes from, falling asleep, light, deeper, our REM sleep where we want to be. Then we go in these cycles. Every 90 minutes we go through one of these cycles. So ideally, have you ever been startled awake by an alarm and just feel like, like you're almost in a panic even? I hate that feeling. Anyway, in fact, I don't think I put that in here, but I'll tell you what I wake up to because of that. The body goes in these natural 90-minute cycles. So this has been a little tricky for me to figure out, but you have to think about when you go to bed based on when you're going to get up. So if I'm going to get up at 6:30, I'm going to go to bed at 11 because that's 7 90-minute cycles. That's the way I always think about it. If I can't go to bed at 11, I'm going to jump until my next cycle. Because if you wake up mid-cycle, mid-90-minute cycle, you're going to be a lot groggier. Your body isn't going to be restored. You're going to feel worse when you wake up. So try to sleep in 90-minute cycles. So my two that I usually stick with are 6 hours or 7.5 hours. If I can't get to bed to make it by 7.5 hours, I'll actually stay up an extra hour and go to bed so I can sleep for 6 hours, because I'll feel better than if I go to sleep for 7 hours or 7 hours and 15 minutes if I sleep 6 hours or 7.5 hours. I know it sounds crazy, but it actually works, and try it. And you'll find when you wake up, if you wake up naturally without an alarm, you'll wake up on those 90-minute things. That's when you're going to wake up. If you think about it, you go, oh, I wake up at 4:30, and then I wake up at 6, and those are 90-minute cycles.
There's an app for that too.
There's an app for everything.
But there is an app that says, like, you say, you punch at what time you want to get up in the morning.
And tells you when to go to bed?
Time to go to bed.
Perfect, perfect. So try it. So the way I wake up in the morning is there's a, I don't think I put it in here, there's a, it's called a daylight simulator clock. And so I set it for, I think it was 20 minutes before I wanted to get up. It starts to go red, and then it gets brighter and brighter, like the sunshine coming up, brighter and brighter and brighter. So when I want to wake up, it's bright, and my whole room is filled with light. And it makes no noise. You can make it have like bird chirping noises, but that would annoy me really bad. So it doesn't bird chirp, it doesn't do anything, it just lights up. And then if I don't want to wake up, I just pull my blanket over my head and pretend like it's not light in my room. But it does work, and it doesn't jar you out of the sleep. So try it. Tech shutdown. Blue light is good during the day, bad at night. You want warm to cool. So you want warm light at night. You want your body to cool down at night. You want it to get from light to dark. Those are all things that would help you sleep. Okay, I think this is out of order a little bit. Well, we already talked about CPAP, but I think this should be where you do start again. CPAP.
My turn.
Yep, your turn.
Well, I talked a little bit about this already, where this just diagrammatically shows what the CPAP does. So when all that, pink stuff, where the tongue is, the muscles, all the tissue, when
all of
we're
this.
laying down in bed and we go to sleep, that falls in the back and blocks off what is the airway. The CPAP just puffs the air strong enough so that it gets past all that stuff. It just blows the tissue out of the way, and it gets the oxygen down to where it needs to be. It gets it down into the lungs.
I did find a problem with this today, though. A woman said that her son, I found a problem with this today in a new patient. A woman said that her son sleeps with a CPAP, and he's young, which I thought was sad. But she said she's tried a CPAP, and it will not work for her at all because no air will go in through her nose. So there's a problem with CPAP I hadn't thought of before.
Yeah, you do have to be able to breathe out of your nose for it.
Or in your nose, yeah, and
I'm
she
sure somebody gets a lot
couldn't.
about
Yes.
nicely.
Yep, she couldn't.
Yeah, it's important. It always has to be nasal breathing. The air has
Yep.
to pass through our nose. And there's different types of masks, and some of them are, they're improving some. But like I said, it can be a bit cumbersome. And the fact is, as good as any of the masks are, the research has shown that about 85% of us after 2 years aren't using it regularly anymore. Meaning just it's too cumbersome, it's difficult to take with you on vacation, in your checked baggage, things like this here. So there's a lot of reasons why it's tough, but it's a solution that overcomes the obstruction in the airway. Looking at the next slide, this is what we talked about with that specialized mouthpiece, that mandibular advancement device, and that pulls the lower jaw forward, or positions that lower jaw in such a way that as it moves forward, you can see the tongue and muscle connections are all on that jawbone and the hyoid bone. And so when that moves forward, it takes the tissue with it, and it opens it opens up the airway and allows the air to then passively move through the nose into the lungs again. Now this next slide, the directed growth, I'm sorry, do you hear that ringing in the background?
Answer it.
Answer it.
So now we're talking about, I didn't order room service.
It stopped.
They're trying to sell me a timeshare, and so I just don't answer the phone in my hotel room.
Exactly right.
And I leave it off the hook so I can sleep well at night. And I tell them to call back in 90 minutes.
That's a lot of good material.
So I love this picture on this next slide, Michelle. Thank you for that. It's great. It shows the teeth crowding. This is an adult woman, beautiful lady, but you can see in that picture on the left where there's just not enough room in her jaws for her teeth. And I imagine if we looked at the picture a little differently, we'd say that she has a large tongue as well. When in reality, I think it's her jaws are a little atrophied or smaller than they should be. And so this shows using an active appliance, a mouthpiece that actively is moving the teeth and expanding the jaws, taking advantage of some of the muscles to move and make a nice rounded wide archway. And now this is the same lady, I'm not sure how much time this was, using the MyoBrace and that DNA appliance that we talked about, and we expanded her jaws and recreated a proper healthy airway. In doing so, there's room. You can even see in the picture there on the right side, the teeth are slightly apart, and you can see space on either side of the tongue. There's room for that tongue to go where it needs to be. And so this is what I refer to as a resolution strategy, where we can, this individual now isn't going to be married to a piece of plastic for the rest of her life. She's not going to have to sleep with that airway or a oxygen CPAP mask for the rest of her life, because we've corrected the anatomy and the skeletal structure to allow her to breathe a little bit better. Michelle, I'll let you wrap it up here.
Okay, I wanted to point out just a couple of things on this page. So this is what's called a MyoBrace, and we've touched a lot on how children have sleep issues, and a lot of it is developmental. So it's all the things that we all did, or do, or whatever. It's the bottle, it's the sippy cup, it's the pacifier, it's those things. And they create a very narrowed arch. My brothers, I have two brothers that are orthodontists. This is great business for them. Everybody needs braces. But everybody didn't always need braces. Braces are a new thing. This is a modern invention. It's not just because we're all more vain. It's because everybody was breastfed before, right? They didn't have bottles, they didn't have pacifiers, they didn't have things that stayed in their mouth all the time. And so this really has changed the growth and development that we have. A lot of allergens and things that are in our air have caused children to not be able to breathe through their noses, so they breathe through their mouth. I'm talking about my son here, really, too. My son is very much a mouth breather, has been his whole life. He breathes very loudly. We hear him all the time, and as he grew, the face grew long. You can see that. This is why when I walked in the room today, I knew that the woman had sleep problems, because she looked just like this, didn't she, Ashley? She looked just like this. And she couldn't keep her lips together. Her face was really long, and she showed a whole bunch of gum above her teeth. This is the face of someone whose jaw hasn't grown wide enough. And so they have to breathe through the mouth, and everything has to grow long. This can be intervened in childhood. So if you know of somebody or have a child that snores, that breathes loudly, that breathes through the mouth, that wakes up with slobber all over their pillow, that sort of thing, or really is restless in the bed, this is called a MyoBrace, and it's, I like to think of it as a growth intervention piece, a growth intervention appliance. So when using this, it's kind of a chewy mouthpiece. They put it in and they sleep with it, and it actually directs the growth. So it can oftentimes prevent them needing to have braces. It can correct the growth of the airway and the upper jaw so that they don't have issues, so that their development is normal growth and development in the head and neck area. It's really pretty incredible. The device for an adult has to be different because we're done growing. So we don't have to direct it anymore. Yep.
I'm just curious on the cost for a child. Is it more expensive than braces or less expensive than
Less expensive than
So
braces.
it could save a lot of money by doing
Save money, and not only money, but think about what you're saving as far as quality of life for the rest of forever for them, you know? Huge.
So
Yes.
how early can you start that? With
Good question. As long as the child will be compliant. So one of our team members is using it for her 4-year-old, and he barely turned 4, like last week. So a 3-year-old you could use it in a 3-year-old. And she said, she was just telling me this today, she said that he won't go to sleep without it anymore, and he keeps it in his mouth until they're walking out of the door to daycare. He loves it so much, he feels a difference with it in. So he uses it all the time.
So is that something from a holistic dentist or an orthodontist?
Holistic dentist.
Orthodontist,
In
so-
fact, my 2 brothers that are orthodontists think it's a bunch of quack, but it's not. I'm going to convince them one of these days. They're going to come over to my side because it's huge potential. You know, it's huge potential to help people's lives change. So it's amazing. There's a couple. There's one called Healthy Start as well. There's a couple. They're the same principle, same concept. But an adult, we're done growing. So we can't just put a chewy gummy thing in our mouth and have the effect like we can in a child. We can't direct growth. So we have to change structurally in an adult. So it's similar to braces, but it's an appliance that you wear. So the DNA appliance that we're talking about, it's an appliance you wear possibly, if you can, 16 hours a day. So if you think about it, you go through your day, you come home, you eat dinner, and then you put it in. You wear it through the night. When you wake up in the morning and you're ready to start your day, you take it back out again and you go through your day without it. But what it does is it directs growth forward, because the whole idea is this top jaw. We want that top jaw to be wider and more forward. That's what had to happen here. Wider and more forward. So this DNA device does that. It pushes the teeth out and forward. Once it does that, the tongue on the bottom, which is a very strong muscle, will then help the bottom jaw to compensate for that. So the top jaw, usually, sometimes we have to do both the top and the bottom, but usually you only have to adapt the top jaw, and then the tongue and the other musculature will allow the bottom jaw to follow suit.
Yeah, I was listening to a webinar, and this lady was talking about how, and I don't remember what it was called, but basically they teach the tongue how to, they do exercises to
Yep.
help the tongue to go
Yes.
back where it's supposed to be. and all of
Absolutely.
this.
Yep.
So is that something that everybody would have to do?
Good question. So it's called myofunctional therapy, and it's very important because, again, like my son. So my son's an interesting example. He's really one of those kind of people that will just do anything if he knows it'll help him. So what he started doing, in fact, I didn't put a picture in about it, he started doing what's called mouth taping. So he actually tapes his mouth closed at night, which forces him to breathe through his nose. He won't do it unless he tapes his mouth closed. Well, he would wake up with a tape ripped off every single night. So now he puts on 5 pieces of tape. Puts one this way, and this way, this way, this way, this way. I walked in one time and I'm like, what in the world are you doing? He's like, this is how I sleep. So that I'm training myself to breathe through my nose because it's such an ingrained musculature habit. So there are therapy things that need to be done to teach the tongue to go up. It's never had room to do it before. To teach the tongue to swallow in a different way. It's never had to do that before. All of those things have to happen along with these devices to be able to really allow, otherwise the musculature will just keep it going back to where it came from. So yes, that's a very important piece. In fact, Dr. Preble, our other sleep specialist, and I were just talking about that this week, and we're saying that we need to train one of our team members to do the myofunctional therapy.
So that's going to be my second question. Is there somebody local?
There are a couple, but there's nobody that really does it exactly the way I want, so I think we're probably just going to end up training somebody. Yep.
I have a grandson that has, the dark circles under his eyes. He's always had this, and he is just tall and super skinny. He cannot gain weight.
Yep.
I mean, they've done every test in the world on him, and
But I bet you they've not done a sleep study.
and so would that be an indicator?
Very much so. Yep.
Okay.
Yep. The body's stuck in fight or flight mode all the time.
Well,
It's chasing saber-toothed tigers all night long.
in
Yep.
ortho, okay, so what, 34 years ago, right, there was a big time where they removed all 4
Yep.
bicuspids.
Yep.
And instead of opening up the jaw, they made it smaller.
Yep. Yeah, it's created a whole generation of baby boomers that are now sleep apneic.
Yep.
An entire generation of people who went through orthodontics and had 4 teeth removed.
and I nursed them all, and none of them wore braces. So, preach.
Yep.
I believe that.
Yep, it works. So why do we do this? Why is this something that we talk about? You know, we really, for those of you who know us, you know that we really focus on a whole body health model, and there's no way you're going to be better until you're sleeping better. There's no way. So we really try to create these customized protocols, support your nutrition, resolve hidden infections. Sometimes the inflammation in the head and neck area may be because you have a failed root canal or a wisdom tooth area that didn't heal properly, all these kinds of things. We look at all of these pieces, and then we have a couple sleep appliance specialists that are right in-house that can help with that. So this is why we're having this presentation. I'm so glad you've all come. Hopefully you've learned something. Any other questions? Yes?
So approximately how much does something like that cost? I know it depends on a ton of things.
Good questions. Anywhere from... Yes, so MyoBrace for children is going to be somewhere in the $4,000 range. Actually, Angie's probably like, I don't even, you're telling, Angie's the one that knows the answers to these. $3,500, okay. And it depends on the age of the child and how much growth that they need to do, but it's somewhere in the, 1 to 2 year time frame. Adults? Okay, so it depends on the kind you need. It goes anywhere from $3,000 all the way up to $9,000, depending on what you need in between those two things. And anywhere from you wear it all the time and it's not really correcting anything, it's just something you're going to now wear as part of your life, or a DNA appliance, which is going to be 12 to 18 months usually of treatment time. Yeah. But, I tell people all the time, I say, okay, a third of your life is spent doing this. A third of your life. A third of the rest of what you have in life is going to be spent sleeping. What do you want your quality of life to be like? Because this will be the determining factor for that quality of life. For the rest of your life, this will be the determining factor in whether chronic disease continues and whether inflammatory diseases take over and whether you die early because of it. So is it worth the time and money right now to improve the quality of the rest of your life? So anyway, that's just my belief. That's why, like I said, I'm so glad I did this, because I'm such a believer now. Like, okay, this is going to change people's lives in a way that I've never been able to do before, if we can get them breathing while they're sleeping. So it's pretty cool.
So now how are you going to correct your son without having to take his
He's going through treatment right now. Yes, indeedy. And he still tapes his mouth. We'll see if he can. Exactly. He does.
People with the deaf whispers, it must have to take those off.
My husband, his CPAP, he has to have the one that goes over his whole thing and a strap on so that he will keep his mouth shut. Because or the air will just come out of his mouth.
But they're much more modern. They're not Darth Vader-y anymore.
Oh,
Like
Chaz is Darth Vader.
The one that I have, really, like when you're gonna go swimming and you put a nose plug on, that's really what it is. That's all it is.
That's good.
I'm still sexy at night, I'm just telling you.
It's important for that 3-year-old granddaughter especially. Good. Okay, anything else? Thanks for being here, guys. I appreciate it. Thank you. Thank you, Dr. Montez, for being there from Mexico.